description of this mobile telephone-based, again, I'm not issuing soldiers cell phones because they already have cell phones. All I'm doing is pushing down not text messaging, but secure messages, HIPAA-compliant messages. And that's the secret sauce. It's got to be HIPAA-compliant, right? So the goal is I got this patient coming back from the war and they're injured. So I got an injured soldier, they come back to Walter Reed, and then the Reserve National Guard, they go back to their homes in Maine or Florida or Chicago, and they get assigned to them as they're undergoing rehabilitation for 8 to 12 months. They have a case manager and a platoon sergeant, and that is the clinical team talking with the patient, and now we're pushing secure messages. What we want to do eventually is bring in mom, dad, sister, brother, spouse into this social networking of cell phones. We haven't got the funding yet to work that piece, but this is an important project for the Army because, as you'll see from the data, we've got over 500 patients enrolled. We started this in August of 2009. December, we had 44,000, close to 45,000. We're over 50,000, I think, in January, and well over 500 soldiers that have enrolled. The Vice Chief of Staff of the Army, the 4-star general, second in command of the U.S. Army, liked this so much, he said, roll this out Army-wide. That doesn't happen overnight. So we're in the process of going through the due diligence to make that happen. But again, we're synchronizing over distance, wounded warriors coming back, Reserve National Guard, not active duty like myself. We're using their cell phones, and we work on over 400 different cell phones. It's HIPAA compliant, and again, that's the key software piece. So it's bidirectional dual authentication. When I enroll that patient in the study, we download a thin client onto their phone when they talk to the server, and when they do send messages back and forth, the server has to recognize the cell phone has to recognize the server, and it's really an important piece of the study. They're simple responses, just clicks. There's not a lot of texting involved. The care team leverages the website, and we're transitioning this project to the Warrior Transition Command. That's a big command run by a general officer. He's a field artillery general who runs the Warrior Transition Command. And you can see the way we work it, you pull up, you know your patients, you know what information they need to get, and we push it onto their cell phone. They respond. The care team can look at it on a graphical user interface in their clinic, and then they track this over time. I'll go over this part very carefully because that's important to understand. We took all 477 at the time, soldiers that were involved, and we using Google Maps, we put it on a chart showing where those 5 community-based warrior transition units are. And look at the geographic distribution. We're in 28 states, these 477 soldiers. And so if I'm trying to reach out to them on a regular basis, it's an effort right now in Maine to drive to Boston. You know, the snow and the weather. And likewise in Chicago, it's no fun ride either. So the whole point here of this map is to show this incredible geographic space we have to cover with these soldiers and trying to reach out to them on a regular basis. And again, sending them messages on a regular basis that's customized to what they want. Wellness tips, appointment reminders, all kinds of important information. We call that all preclinical, has been important. We develop a dashboard, and the way they answer those messages are then charted so that if I'm the case manager and I go on vacation, now I'm covering your patients, I can look at that soldier and say, geez, under mood, he's green. So he's tracking well there, but not so good under their comprehensive transition plan. They got some red numbers there and not well at all in terms of relationships. We got to work on that. So he's having problems with his kids or his spouse or his parents, depending on the age of the soldier. And then we have this toolbox of things that we customize those messages to. So, for example, the scheduler, appointment reminders, wellness tips. You know, I've got nutritional problems, I've got pain problems, I've got sleep problems. We push out information that's relevant to what I need to know. And then we got the fun stuff, headline news, joke of the day, sports scores, because maybe I just want to see how my Pittsburgh Penguins are doing when they play Boston on Saturday. Any Boston Bruin fans in the audience here? All right, there you go. All right, I'll be thinking of you guys on Saturday. So then here's the key. We take every one of those questions, and they're all algorithmically driven, and it's coming from a database that has already been validated. That's key. I am not just pulling information out of my head and putting it out there. A group of people had developed validated content, and all we did was port it onto a cell phone platform. And then we have these answers. So this question says, in the last week, how have you been feeling? So I feel great. You see, so what they see this question, they get these choices. I feel great, I feel okay, I feel crappy, I really feel terrible. And if they click 1, 2, 3, or 4, it generates, you know, if they click a 1, I feel great, great. We plot that particular point on their mood on that chart. If they feel crappy, it generates another message and also sends an email to the healthcare team saying, hey, Sergeant Smith isn't doing well in this particular issue. So now we can trend. If they feel great, it's green, okay, yellow, not so good, red, and if they don't answer the message at all, it's black. So now I can trend over time, and also I can mouse over these little high points here. I can mouse over this particular life event. Well, why do you go from red to yellow? Well, that's when he found out that his son just got into college. And so he's kind of happy now. His mood got better. So you now have this longitudinal record of these patients, and it's incredibly important when you do these battle handoffs between different healthcare teams. We're hoping to start, and I keep saying that, I feel like Bjorn Borg at Wimbledon. I'm down on my knees praying, please let me start this research study. I've been ready since January of 2010 to do this research study. The protocol has been approved at Walter Reed and Dwight David Eisenhower at Fort Gordon. We're looking at the administrative issues, clinical, technical, and systems-based. We have outcome measures identified. For example, can we decrease the no-show rates for appointments? Can we increase communication between the healthcare team? Are we providing awareness of this comprehensive transition plan? Don't forget, if I'm a construction worker and I'm a reservist and I go to war, and I got hurt, I can't do construction anymore. So what am I going to do the rest of my life? That's the transition plan that we put them on. And so we want to know, how well are you doing? Are you going to junior college? Are you getting your degree? Are you getting yourself out of debt? Are you working on your relationships, et cetera? These are all the things that goes into that soldier's comprehensive transition plan, which is the most important thing that we've got going on. So in addition, technology-wise, how well is the system working? Then we do focus groups at the end. I'm stymied by the federal bureaucracy of getting information assurance certification and moving it from a commercial server to a government server, and then all the secret handshakes I got to do with the folks to start the research, but we hope to start in February. Of course, 6 months ago when I gave this talk, we had hoped to start in July of 2010, but so we're well positioned. We've got the patients, we've got the sites, we've got everyone primed to go. So that's the second project I want to talk about. I got 3 more, then I got Big Army to talk about, so I'm going to have to pick up the pace. Dengue vaccine I mentioned. Dengue is a terrible viral infection. It's in 110 countries. It kills over 30,000 kids a year throughout the world. There's no vaccine right now. We're working with Sanofi Pasteur, and the U.S. Army Medical Research and Materiel Command co-developed this vaccine. We're doing the vaccine studies in Thailand and the Philippines starting in, it's supposed to be July. They just moved it up to May. So now we've got to really get this project up and running sooner. The point is that dengue is transmitted by the Aedes aegypti mosquito. So the mosquito is where all this light purple is located. That's where the mosquito lives, no dengue, but you can see in the red, like Texas is showing Florida, you can see Texas, this is where dengue is endemic. So pretty much equatorial across the world. You can see in Thailand and the Philippines, there's a lot of dengue, and that's where the vaccine trial's going. So it's a big problem, and that reason we're doing is because we send soldiers to those places, and there's no vaccine. They get sick, and I've got one guy who can do a specific military task, and he gets sick. Now I'm mission down. I have to have everybody hands on deck to do what they need to do. That's why we want to conserve the fighting strength. We've got to come up with a vaccine, vaccinate these guys, put them in harm's way, and hopefully they'll do okay. So what we've done, as I mentioned, is we're going to recruit 6,000 patients. We're going to follow them 3 years. We're going to send with our commercial vendor, Damagi. We competed this. Damagi's out of Boston, Massachusetts. They're developing the capability to use open source SMS and text down to the Thai and the Philippine population. We're hoping to reduce protocol deviations, facilitate dissemination of information, support execution of risk communications. I mean, we want to remind people you're in a vaccine trial. You either got the real vaccine or a placebo, and I need to follow you to see how effective that vaccine was. And so that's why this is such an important project. It relies on communication between the staff and the patient being vaccinated. Break, as we say. Move, next topic, number 4, mobile learning. So how does cell phones get involved in learning? Well, it's important to tell the story that the role of the U.S. military health system is very active in humanitarian missions. Haiti last year, 82nd Airborne went down there, Air Force went down there with big lift capability. We're all over the world whenever there's a disaster, either natural